Hello everyone, welcome back to the Big Green Wall versus the Little C, and this is episode 4. And today we are going to talk about what I've been doing in the last 3 weeks. It hasn't been the greatest 3 weeks, so I'm going to share that with you.
So we talked about things that you feel comfortable talking about as well. So we'll be led by you, Garry, because we've had a bit of a discussion beforehand, and there has been so much going on. If you're happy to share any sort of challenges that you've had, and then we will talk about any highlights as well.
So, right, I think we've covered about the my pain relief. We've covered pain relief before in the past. So originally I was on morphine, and then they put me onto the patches. That goes into my body 75 milligrams per hour over a 72-hour period. So I can't have showers because they're not waterproof. We have tried to put the big patches on, but obviously being on my own, I can't waterproof it. So I've got the sanitizers and hand sanitize and hand wash. So I think what I'd like to do is that when I had the drain in 6 or 7 months ago, it was taken out. But recently I've started to get the same problem. So I think what I'd like to share is why my body's changed, how I know my body's changed, and what we're going to be doing about it.
Okay.
So, right. So basically, the bloatiness and just being generally uncomfortable. So all around the midriff, and it's almost like I'm retaining lots of fluid. So recently I've become more uncomfortable. So therefore now I've got to go for a set of scans, and the bloods have been taken, waiting now to get in front of the doctor. And then hopefully they're going to start the process of the camera. So they said, but this is a little bit where I haven't had the camera before. So I should imagine they're going to be looking at my bowels to see how I am or what's going on with my bowels.
So the bloatedness, you're not sure what's causing it. So are you saying, Garry, it could be the fluid that you've had before around your sort of stomach area that was drained off?
Yeah, so what happened? So my I didn't have a immune system. So my body then produced its own immune system, which was a liquid. And basically I knew that there was something wrong because I couldn't sleep. It was uncomfortable. When I moved, my whole body was sloshing left and right. And they did a temporary drain on me, and they literally removed 8 liters of fluid from me the first time. A week later, they did the same procedure, and they drained another 5. And then about 10 days after that, they drained another 7 liters. So that's when they came up with the idea of giving me what they called a rocket drain. And the rocket drain then is a permanent drain, and that's when I had the care nurses come round, and they would come round 3 times a week, and they used to drain me. And then they taught me how to do it myself. And the more I got my immune system back, the less fluid I was making or producing. And I think, correct me if I'm wrong, I think I had to do something like less than 10 fluid ounces, and then they made the decision to take the actual rocket drain out of me, which has left two quite deep scars. But yeah, they removed the rocket drain. Now I was quite lucky because the rocket drain doesn't normally come out of a human being; it comes out of someone that's passed. So yeah, that was a little bit of well, to be fair, it went down in history books.
It's unusual, wasn't it? So it's ascites that you're talking about, isn't it?
Yes.
Collection of fluid.
Yeah. And that's the problem. I'm almost going through that again, but now I know fact it's my bowels, and so I've got an oral solution that I take twice a day, that helps me go to the toilet. And I also got the suppositories. That one is a glucose that softens up the stool.
Yeah.
And then the other one's one that's more of an impact in it. So when I was doing this before, it was great. It's almost though my body now has got to the stage where it's almost become immune to it. So I've had to let the team know, and this is why I've got a doctor's appointment, and they're going to go up that stage further now. And again, we've always mentioned this is about awareness and sharing what we do, and I think it was quite important to share that, because there may be someone sat there that's going through the same uncomfortableness, or think that you haven't been to the toilet for, you might think it's only 1 or 2 days. I've kept a record of it, and I'm now looking at maybe 5 or 6 days.
Yeah.
So I do go, but I don't naturally go, and it's almost like a fluid, and I think the phraseology for it is a top block.
Yes, it could be like an overflow.
Overflow. That's what
If it's like a very liquidy fluid,
Yeah.
people sometimes think, oh, well, I am passing something, but it's usually, if you are constipated, it's that fluid that passes over that constipated stool, and it's just water that spurts out, which is.
And that's exactly right. So I've gone from the water to the straining to then claret, and thinking, wow. And it was then I've put the tick in the box and picked the phone up and said, right, look, when I see claret, that wasn't right. And I know.
Yeah.
So on a pain scale, although I've got my pain relief, I am knocking around constantly on a 3, just because it's uncomfortable. But I also know now that if they do put the camera inside me, then they're going to give me that explosion, clear me out, and I'll be looking for that. That's all I want. I just want to clear. I just want to be.
Yeah.
So it's weird, because I'm eating, and generally I've got my appetite back, whereas before I didn't. And now it's almost like no matter what I eat, it's because I thought I was going, as you said, with the fluid, but it's not. It's blocking and getting, and I really feel drained. I don't know. I'm wary of my breath, maybe smelly. I'm wary of me being clinically smelly. I don't know. It is a horrible feeling. I just feel generally dirty. So.
And you said before we started the podcast you wanted to talk about it, because a lot of people don't want to talk about going to the loo, constipation, but actually being constipated can have a massive effect on people.
Yeah, well, to be fair, when you see the constipation could lead to death because of the straining. But I've physically sat on the toilet, and I've had sweat dripping down my forehead, off my nose, and puddling between my legs. Because if anyone's not, to be fair, I'd never, lucky enough in my whole life, I don't think I'd never experienced constipation. And you hear of people talk about it, and I mean, people who have spoken about it in my life, and you cringe when you hear the word constipation, because it's nothing that we like to talk about. But I just think it's really important that people need to be aware of the top flow, and if they haven't got the symptoms of cancer, it's worth getting checked out in case they have got that block, and it could be something else.
Yeah, because for anybody, it's knowing what your normal is, isn't it? So if you're a daily person who goes to the toilet, or sometimes people are every other day, what is your normal, and what does your poo look like? And then if anything is abnormal, it's just monitoring. And you did right. So after 3 days of not passing anything apart from this water, to think actually this isn't right. And that's when you, like you say, picked up the phone and spoke to, was it your nurse that you spoke to?
It was Fiona, yeah. And the worst thing is the because I've now I've experienced passing when I have been constipated. Twice I've experienced the constipation, and twice I know exactly when it was. And I don't want to be going through it again.
Yeah.
I know that I am. And the other thing is that, right, when it's always nice to pass wind, right? We do it jokingly, and we've all done it, right? And unfortunately, it's natural we do it. But the thing is, though, I'm now finding myself sitting down to do that, because I don't know what it's going to be. That's how bad mine is at the moment. So and I do find that when I do have wind, it's almost like it is a relief. But what amazes me is, how can I have wind and it's like dry, a dry wind,
Mm.
but then the next time I go to the toilet, it's absolutely, it's a spray, soaking wet and horrible. So clearly there's something not right inside me. So now it's the time to push the button and get myself sorted out and checked out. So it might be that I'm immune to the medication I've been given at the moment. Recently,
you need a bit of extra help to pass what's there.
Yeah, I'm not looking forward to it, but it's got to be done. So the process is, they've escalated me through, literally, and this is how good the NHS was to me this morning. So I left a voicemail at 6:10 last night in the local doctor's. A lady called Anne. I've got an emergency line that they've done it on purpose, because there's nothing worse than you are number 46 in the queue. So they said, if ever I need it, then use it only in emergencies, and I needed that yesterday. So she called me at 10 to 8 this morning, and I've now got a doctor's appointment at 20 to 3. So that just says to me that it is quite serious and it needs to be looked at.
Yeah.
So, and again, just to make everyone aware that it is, and it can cause very, it can cause bodily stress, which could lead to a lot of things. So, yeah, for anyone that is out there and you are suffering, then yeah, just definitely speak up about it. And the saying, where if you've got blood in your wee or you've got blood in your stool, then you need to pick the phone up, definitely.
Yeah, absolutely. Because we were saying constipation can cause that feeling of grogginess, tiredness. Some people can get confused, as well as like the pain around. And if you experience pain anyway in that area, don't you? So it must exacerbate it, make it feel worse.
I generally do feel drained today. I feel drained today, Pete. I just repeat. Yeah, that's got to do with the memory bit that you just mentioned. I think. No, I'm joking. I haven't quite that. It hasn't affected me yet. Sorry, Paula. That part of it, I think, right, I can cope with that. It's just being uncomfortable and look, see the funny side of it. I have to see the funny side of it. But yeah, so that, and the bloatiness, right, I know for a fact, so the signs that I've done, I weigh myself daily. I know for a fact that I've definitely put weight on, but I haven't eaten anything other than what I'd normally eat. There's definitely weight gain, there's definitely fluid retention, and there's definitely, I mean, to be fair, I've just started watching Game of Thrones again. It's a 55-minute episode and there's hundreds of episodes. And I can't even stay awake. I can put it on, and within 12 minutes, it's almost like the TV becomes a giant hypnotism screen. So then I know there's something not quite right. But I've been like that now for the last, I'd probably say 7 to 10 days, and certainly been blocked for the last 5 or 6. And if truth would be no, yeah, that's my stomach rumble, yeah, and it's going like that now. But if truth, I think it's probably more like a week. So yeah, it's not very pleasant, and I feel really dry mouthed as well.
But the key take-home message is, as you say, contact your
absolutely,
GP or your healthcare worker, and nip it in the bud so that it can be sorted.
Yeah, but on the and that's not the positive side of it. I'm sorry, the negative side. Obviously, the positive side is that we're doing something about it. But other than that, since we've met, I've just tried to get on with it, just normal daily life, normal daily routine.
So anything that but last time we did the podcast, you had that day down in Lowestoft. Well, it was weekend, a couple of days, wasn't it?
Yeah, that's right.
Has there been anything else since?
Yeah, I did. So I went down to Cheryl Baker from the Fizz. I went to her garden party. So yes, I was invited down, darling. No, it was she basically, Cheryl supported me. So I said I'd like to support Cheryl. So what they were doing a fundraiser, and it was for Cheryl's twin daughters, and there was they were doing a play, and it was she held a festival in her back garden for friends and family, and it was just promoting the fact of her daughters, the musical, and yeah, they're actually performing up in Edinburgh now. So it was nice just to go down and have a chill out. So again, it was a bit of a venture, 2.5 hour drive down there. Then sitting in the garden, it wasn't too hot. It was ever so relaxed, ever so chilled. generally just a nice day. I did drive back on the same day,
Did you?
and I've not done that. I mean, that was like 12 hours on the go.
Mm.
But again, before I did it, it's only a couple of weekends ago. But this is when I knew something was wrong because I'd almost starved myself. I didn't eat while I was down there in case I had an accident. So yeah, I had to sort of pre-plan what I was doing and making sure that, and there's nothing worse than seeing everyone else enjoying tacos and all the rest of it when I was, but it's a little bit of self-discipline. I'd rather go without. But I drove back, got back for about 10:30 that night.
Mhm.
And then lo and behold, the Monday, Tuesday, I was out of it again.
Yeah.
So, but it was nice. It was nice to go down, and it was nice just to chill out and see families and kids playing around and everyone enjoying themselves. Just, it was a bit of change of scenery. Really nice.
So you went to Cheryl Baker's garden.
Yeah, and
That's
yeah,
cool.
met the family, and yeah, and she actually follows me on Facebook. So yeah, big shout out. Thank you very much. It was nice. But yeah, so there you go. I've really sort of had it. I've not done a lot. Kept I've just kept my head below the parapet, in all fairness, because of the last few days with this. But hopefully we'll get a resolve and I'll be up and running again. But what I will say is that it's almost a year. It was on the 16th of August I was diagnosed. So by the time this is live, it'll be my year anniversary. And then on the 7th of September is when they came up with the diagnosis and how they were going to obviously treat it. So yeah, we're doing all right.
How do you feel about that? Because I know some of our people will say, that they really struggle with anniversaries of the diagnosis was given, or
I think it's gone really quick. I think it's gone really fast. To be fair, thinking that it was only in February, and I was sort of given I was able to get out of a shared accommodation, and then I was able to have my independence, and the whole 6 months has gone really quickly. That's me just come round to term again with my next 6 months of my rent. So yeah, it's just quite. I don't know, but I've not even thought about it. I just take each day as it comes. Honestly, I just keep battling on.
It's good. That's essentially being mindful, isn't it?
Yeah, I think so. I don't know. Do you know what?
Day by day.
Yeah, yeah. And there's a lot of people out there that are supporting me, and yeah, there's people that check up on me, and yeah, it's nice to know that there are people out there that are looking out for me. But I don't look out. I don't honestly. There's no, as far as I'm concerned, it is what it is. Let's just keep going.
So you've got to go through the resolving the issue that you've got at the moment, potentially with constipation and that. Is there anything coming up that you've planned to look forward to? I know you've got the fundraiser.
Yeah, I'll be going to that, and I'd obviously with it being local in Corby. So and they're allowing me to do bits of filming, and we're having a bit of a live podcast, and that's the Raven Hotel in Corby.
And what date is it?
I believe. I know you're going to ask me that. You put me on the spot.
We can add that in.
Yeah.
We can add that in.
Yeah. I think so. I think it's the 29th of there or thereabouts, or maybe the 26th. Or something beginning with a 20.
Yeah.
I don't know. But you have to do that. Yeah, we've got the fundraiser. And then really, I think, no, I don't think there is nothing. I haven't, I think I need to get this sorted out first, because I almost feel trapped. I do like to get out. I do like to get my fresh air. It's not as though I can walk, or the weather's not been the greatest for sitting outside recently. But yeah, I just need to get this. I need to get this rectified, and then we can move on, and then hopefully get a few. I've not booked to go away. It's just there's little things that maybe we should talk about that next time. In fact, that would be a great place to call it, because we can perhaps talk about what I look forward to and what I'd like to be able to do, and then come up with a plan.
Yeah, brilliant.
Yeah, cool.
Okay.
So thank you once again for listening. But can I just remind you all, please, to follow or share or do what you do, and please tell your friends or family, because we are there to hopefully have an insight to what's going on, but to just make everybody aware that you've got Macmillan, you've got your facilities, and that you can live with cancer.
Thank you.